day, everyone. Thank you for joining with us. And today we have the privilege of welcoming Dr. Manoj Kumar, MSc, MPH, PhD, DSc, UGC, and ETA. Is working as an assistant professor in Center for Public Health, Punjab University, Chandigarh, India. And he's having more than 20 years of research and teaching experience in environmental and public health at Punjab University and PGMER, Chandigarh Premier Institute of India till date. And he has guided 11 PhD and more than 100 master dissertations. And he has an index of minus 24 to 2000 to 228 plus citations. And he has published 71 research papers and 6 book chapters and 5 books. He has presented research article in more than 30 national and international conferences, and he is the member of Indian Public Health Association, which is IPHE, and Epidemiology Foundation of India, EFI. So throughout his career, Dr. Manoj Kumar has been recognized with the following awards: Diligence Award during a Faculty Development Award 2022, and International Award of Outstanding Contribution in Environmental Health 2022, and Best Assistant Professor of the Year Award 2022, and NADA Good Health Ambassador Award 2022, and Dr. SD Gavood Award 2010. So, in today's webinar, Dr. Manoj Kumar will be sharing invaluable insights on a gateway to transforming communities. So, without any further ado, so please join me in giving a warm welcome to Dr. Manoj Kumar. Over to you, Doctor.
So, welcome you all. I am Dr. Manoj Kumar, Assistant Professor in Punjab University, and teaching Master in Public Health course since last 16-17 years. And I have guided PhD students and currently also guiding PhD. And I am associated with Texila American University since last 4-5 years. So, today, the title of today talk is a gateway to transforming community through public health is the title of the talk. So without delay, I will start my talk. So first, we must know what is public health. At large, public health, we must know that health of the peoples around the world, in our country, in our state, or at local level, we must be concerned with the health of the peoples. So this is basically you must know like this is an approach. So in general, we must know like prevent it deals with to prevent the epidemics and the spread of disease. Like uh, recent in recent past, we have a situation of COVID-19. So in this situation, the importance of public health is very much, and it is like very important to know the concerns of COVID-19, and public health play a very important role in this. So it deals the protect against environmental hazards and respond to the disasters and assist community in recovery. So disaster is again an important concern in public health, like UNDP, United Nations Development Programs, is directly linked in this concern. Like in many disasters, the role of public health is very, very important, and role of public health professionals, epidemiologist is very important. Public health injuries is again a very important topic which have to be covered, which you must know. Injuries may be intentional injury, and sometimes there may be unintentional injuries. Sorry. So like intentional injuries, like sometimes violence, planned violence, and unintentional is like sometimes any kind of disasters or accidents. And in intentional injury, suicides may be one of the aspects. And another important is promote healthy behaviors, healthy lifestyles. So there you must be aware, like this is the era of non-communicable disease, and all communicable disease we have controlled, and we can have a like these are reduced to a certain levels, and now uh, emerging non-communicable diseases are there, like diabetes, hypertension, cancer, road traffic accidents. So these are the some of the examples of non-communicable diseases which are emerging and which we are facing nowadays. So the role of public health is very, very important in this concern, and assure the quality and accessibility of health services. How the health care facilities are available in a country. So a public health system, we must know public health entities who are key role players, and what is public health entities, what is private entities, voluntary entities. So public health, what is public health actually, we must know the health of the people around the world. So public health is an art and science of preventing disease, prolonging life, promoting health and efficiency through organized community effort. Definitions by Winslow, 1920. The process of mobilizing and engaging local, state, national, and international resources to assure the conditions in which peoples can be healthy. This definition is from the Oxford Textbook of Public Health. So there are certain public health services, like we must know what are the important health services, like research for insights. Before before starting public health, we must research in public health, like what are the current research, current public health issues, and how we can control these public health issues. For that, we have to evaluate and improve, and like we can start from like serial number one. Like first, we must monitor the health. Then second is diagnose and investigate. Then third is inform, educate, and empower. Fourth is mobilize community partnership. Fifth, about develop policies. Sixth, enforce laws and regulations. Seventh, about link to care. Eighth, assures competent workforce. And nine, evaluate and improve. And last, research for insights. So this is like a circle by which we can control a public health problems, or we can understand public health issues. So these are the different areas of public health, like behavior related, social sciences, epidemiology, biostatistics, informatics, health policy and management, maternal and child health, environmental health, global health, health promotions, and there are certain other areas like health economics, disaster management, and health programs. So these are the different areas of public health. You can say the different subjects which we must read in public health and have the concept of public health. So scope of public health, starting with the surveillance. I think you must aware with this term surveillance. Surveillance is like continuous watching of the trends in of diseases in a particular area or in a community. So there is difference between surveillance and monitoring. Monitoring is just monitoring a parameter. Surveillance is basically to see the trends. Then analysis, to analyze the trends by using certain statistical tools. Then to study outbreaks, epidemics, disease prevention, communication, risk, and research, and health promotion finally. So like in functions of public health, like monitoring status of a particular problem in the community through the tools using like epidemiology, like statistics, like experts team of public health professionals. So a public health professional must be trained in all these subjects. Then diagnosis and investigate health problems and health hazards in the community, and evaluate effectiveness, accessibility, and quality of personal and population-based health services. Then policy development, inform, educate, and empower people about health issues, mobilize community partnership to identify and solve health problems. Like sometimes we have to use like community or like peer groups, peer educators are required, and for that role of community is very important. And how we trained the community, how we collect the information from the community in a right way. So develop policies and plans that support individual and community health efforts. Enforce law and regulations that protect health and ensure safety. Assurance link people to needed personal health services and assure the provisions of health care when otherwise unavailable. Assure a competent public health and personal health care workforce. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. So these are the three domains which overlap, like health protection, health improvement, and health services delivery. So how effective is our health services delivery is important for the protection and improve in the health. So this is a like network of public health system. It includes uh, many aspects: doctors, hospitals, schools, church, home health, health department, EMS, THCs, civics groups. So these all are interconnected while we are studying public health or we are applying public health. Like laboratory facilities, you can see is uh, it must be connected with doctors, CHCs, drug treatments, etc. Similarly, drug treatments are based upon laboratory facilities, mental health, hospitals. Then mental health is connected with like tribal health, health development, then hospitals, philanthropist, then civics groups, then with the drug treatment. Similarly, employers at the bottom may be connected with tribal health, philanthropist, health departments, and economic development. And last one is economic development may be connected with like employees health, then tribal health, environmental health, elected officials, mass transit, fire. So you can see this is a like network which depends on each other, and the activities or term we use is connected with others domains also. So these all are like you can say mental health is a current issues, uh, and there are many non-communicable disease related issues. Environmental health is very important aspects as we have different kind of exposure in terms of air pollution, water pollution, poisons present in our surroundings, and sometimes like quality of foods is very important. Health at school health is another important aspects, and role of like hospitals, doctors, and health system is again very important. So this is showing how health system works and depends on each other. So this slide show the role of political system present in a country or in a system. So as the political system changes, it directly indirectly affects the health system of the country. So healthcare system like functions, system arrangements, government delivery, financial policy, different kinds of policies, public health system functions, system arrangements, government delivery, financial, partnership policies, and individual factors is again very important, like health of a person, individual, like its genetic factors, their education, income, culture, lifestyle choices, social networks, and employment. So these all are basically have to be studied in details, like genetics, you can say height and weight of a individual is different in different countries. Their lung functions are different and their immunity may be different, and it are always directly indirectly linked with the education in the family, education of mother, education of father also affect the health, and education of the children's school system, educational system in a country, and then income, like as we have different levels like BPL, below poverty lines, lower socioeconomic status, middle socioeconomic status, and higher socioeconomic status. So disease conditions may be different in different income groups, and it always connected with different kinds of culture also. So culture, like you can say, it changes in country to country. Anyone can anyone focus why the life expectancy in Japan is high? So here I focus how the culture of a country affects the higher life expectancy. Like in Japan, which is a very famous example, like they are having highest life expectancy in the world because of their food habits, their culture habits, and these food and culture habits are analyzed many times, and like they are having a particular kind of specific kind of foods, climate situation also for their higher life expectancy. So it is my request to explore this, like why life expectancy is changed all over the world in different parts of the world across the like different world regions. So and again, highest centurions, like those who have completed age of 100 years, is found in US because of good healthcare facility available in US. And then lifestyle choices, as we know that today we are facing different kinds of non-communicable disease because of lifestyle choices, our change in food patterns, like we are having more trans fats, we are having more stagnant life, we are not going outside, we are having more screen times. So these all are basically lifestyle changes. And social network is again very important, like now we have WhatsApp, we have Facebook, social network groups, but in past we are not having such type of things, and we are more connected. Although then employment is again very important. Different countries have different kinds of employment policies. sometimes in developed countries they are having unemployment, like unemployment funds, and unemployment person will also get some remuneration from the government. So, but in developing countries, these are the situations they are facing. Like youth are facing such type of situations. So, in developing countries, they have different kinds of challenge as compared to developed countries. So, health system is entirely different in Asian countries as compared to European and American countries. So, and there is need to work on these situations, like how we can improve this health systems and which health system is best in the world. So, like developing countries, we are having only 1 or 2% of total budgets for health. On the other hand, in developed countries like America and Canada, they are having more than 8% of their total budget for health only. So, which definitely impact the health of individuals or health of the population in a particular country. So, this diagram is showing like what are the important domains in public health. Like first is epidemiology. I think all of you must be aware what is epidemiology. Basically, epidemiology is a tool to study public health. We must know how to apply epidemiological principle while studying a particular public health problems in the community. For that, sometimes we calculate prevalence, incidence, and we have different kinds of research methods. Like sometimes we do cross-sectional study in a community, sometimes we do cohort, sometimes we do ecological studies like that. And similarly, biostatistics, we must have the basic knowledge for biostatistics. Like we must know how to apply basic biostatistics in a particular results or data collected from the community. Then health education, how to educate health uh, uh, about the different issues in a community, and health promotion is also the part of this. Then nutrition and diets. So nutrition is very important part in public health. Then maternal and child health is the backbone of public health, you can say. So as you know, like we focus more on health related issues of mother, health related issues of child. IMR, MMR is a common terminology we use in public health. And nowadays we use a term global health. So public health and there is difference between public health and global health. So global health is basically to compare different health issues across the world in different world region, in different WHO regions or in different countries. So global health is again a very important aspects, like we see the trends of different kinds of trends, how these varies from in uh, different parts of worlds. Like as we have approximately 204 countries in the world. So they are basically disproportionate. Health issues are disproportionate. Some health issues are common in a particular country, some are not found. So we must be aware what are the health issues present in a country across the world. Then public health administration, like public health administration means how to basically use health system in a country and how it is effectively be used. Then public health policies and programs. There are different public health policy and programs in different part of world. Like in India we have national health missions, which is a major health programs, and national health mission is again divided into national rural health mission and national urban health mission. So NRHM and NUHM, and this is the biggest health program in India, and which have another many other small programs under this. So this is the like broad, you can study public health. And then workforce, diverse and multidisciplinary, like a public health person must be a good biostatisticians, dietitians, environment health specialist, behavioral health specialist. So he must have the knowledge of all the subjects. Core components: assessment of the health of community, assurance of the public's health, and policy development in the public's interest. So 10 essential services related to health is monitoring health status to identify community health problems. So sometimes we say like to collect baseline data. So for a particular health situation or health condition, we must have the idea like how it is spread in the community, or how it is spread in like different strata of the community, among male, females, among urban, rural area, among different uh, different income groups, different uh, strata. So diagnosis and investigate health problems and health hazards in the community. For that, uh, for diagnosis and investigate, we must have good team of medical doctors and paramedical staffs, healthcare facilities, laboratory facilities. Then inform, educate, and empower people about health issues. So basically, if we know what are the issues, then only we can informs or educate or prevent the health condition in a particular community. Mobilize community partnership to identify and solve health problems. 10 essential services link people to personal health services and assure the provisions of health care. Assure a competent public health and healthcare workforce, and evaluate the effectiveness, accessibility, quality of services, and research for new insight and innovative solution to the health problem. So public health approach, you can see in this figure, in public health model, we focus at community or at large population. In medical model, we focus only on individual basically. So determinants of health, there may be different kinds of determinants. Like first is genetic. Many diseases are genetic sometimes. Behavioral also. Social determinants, environmental determinants, personal health care. What are the achievements? Biggest achievements you can say is the vaccination. A success story of smallpox eradication is the example in this concern. So vaccination is the most important successful story. Vaccination is the most important achievements in public health. Safer workplace. There are different kinds of industries, different kinds of jobs, different kinds of exposure at workplace, or risk at workplace. So as we know that in industry, sometimes they use PPE kits. Sometimes there is need to improve the workplace risk. Then safer and healthier foods, again very important. Like now the era of fast foods, we we need immediate foods, instant foods. So, but these instant foods may be unhealthy sometimes. Motor vehicle safety is again very important issues. Road traffic accident is the biggest issues nowadays. Control of infectious disease. There are we have control of many infectious disease. We have controlled the situations of COVID-19 also. Family planning is again a achievement you can say. Decline in deaths from heart disease and stroke. So like these are the non-communicable diseases and we are facing these situations all over the world. Deaths and heart disease, deaths due to heart disease and stroke are basically increasing, but due to application of public health awareness and public health awareness in community, these trends are declining. Recognition of tobacco use as a health hazards. Tobacco is risk factor for different kind of diseases related like high blood pressures, like different respiratory diseases, like chronic obstructive pulmonary disease, COPD, bronchitis, then healthier mothers and babies. This is again achievements through continuous effort of public health. Safe drinking water, fluoridation of drinking water. So there must be minimum amount of fluoride present in water, its axis and its uh, if fluoride is not present, then it is again harmful, or if it is uh, in high content, then it is again harmful. So minimum requirement of fluoride must be present in a drinking water. Then what are the top 10 achievements in 20th century? So like this is like again repetition of the slides, like first is vaccinations, second you can say motor vehicle safety. Although motor vehicles are increasing, but their safety measures are also increasing, like safe use of seat belt, use of helmets, use of good quality of vehicles. Then safer workplaces is again very important, and control of infectious diseases, decline in deaths from coronary heart disease and stroke, healthier mother and babies, safer and healthier foods, family planning, fluoridation of drinking water, recognition of tobacco use as a health hazards. So I think you have heard about the Sustainable Development Goals. MDGs, Millennium Development Goals, have to be achieved by 2000, and these SDGs are basically by MDGs have to be achieved by 2015 and SDGs have to be achieved by 2030. So now we have some targets of sustainable goals which have to be achieved by 2030, designed by UN United Nations. So these are 17 goals, and you can say these are the 17 important health issues or issues relate all over the world. Like first is no poverty. So poverty is directly linked to the different health conditions. Zero hunger, food choices must be there. Good health and well-beings. Fourth is quality education. Then gender equality. Fifth is gender equality. Sixth is clean water and sanitation. Many health conditions are because of unsanitary, unhygienic conditions. And clean energy. Then decent work and economic growth. Industrial, okay, then required inequalities. I think you must be clear about equity and inequality, difference between that. And so these are different You can say like climate actions, like life below water, life on land, peace, justice. Okay, and all these are the different sustainable goals which have to be achieved and which are the target all over the world. And again, very important issues nowadays, climate change and emerging public health problems. So the role of public health professionals is very important in that mitigating the impact of climate change, the impact of climate change on mental health, the impact of climate change on nutrition, the impact of climate change on infectious diseases. So this is very, very important health issues at present. And neglected aspect of public health, the stigma surrounding mental health. There are like issues right now. We have like stigma in mental health, in HIV/AIDS, and impact on public health and needs for comprehensive approach. So in public health, for to control the issues, to control the situations, to act for different public health problems, we must have some innovative ideas, innovative innovations in actions. So solution to public health challenges is through innovation in actions and how we can apply these principles to control the different situations or health issues. So this is my message.
If you would like to have, yeah, final summary, like if you would like to have points, like you can just to summarize.
Okay, okay. So I just wanted to say that this is an emerging area. Public health is an emerging area, and like it is having very good scope as, and it is. I think I can say it is an interesting subject also, and it is having a very nice and good scope of jobs all over the world, and it have different kinds of domains also, like it have like global health, epidemiology. So these are the different branches you can specialize in these also. So this is the message. Thank you. Thank you in my session.
Yeah, thank you so much for sharing your invaluable insights, Doctor. And also, once again, a big virtual thank you to each and everyone who has joined in this session and making this webinar so successful. And thank you for so much for everyone. And thank you so much, Doctor, for your time and efforts.